Rhinsporidiosisis is a chronic granulomatous disease caused by the aquatic protistan pathogen Rhinsporidium seeberi. It primarily affects the mucous membranes, especially the nasal mucosa, but can also involve the eyes, skin, and other areas. Rhinsporidium seeberi is an aquatic protozoan-like microorganism. It is not a true fungus, despite having similar features. The disease is primarily contracted from contact with stagnant water bodies where the organism resides. It is most common in tropical and subtropical regions, especially in India, Sri Lanka, and parts of Africa. It primarily affects humans, but can also be found in animals like horses, dogs, and cattle. There is a higher incidence in males, especially those frequently in contact with water. The primary mode of transmission is direct contact with contaminated water, and there is no evidence of human-to-human transmission. Trauma to the mucous membranes can facilitate the entry of spores. Infection occurs when the spores of Rhinsporidium seeberi come in contact with mucosal surfaces. The organism forms large sporangia within the tissues, which contain thousands of endospores. The sporangia cause a chronic inflammatory response, leading to the formation of polyps or mass lesions. Nasal involvement is the most common presentation, characterized by nasal obstruction, epistaxis, and nasal discharge, along with the presence of a pink, polypoid mass that is friable and bleeds easily. Ocular involvement may present with conjunctival masses, epiphora, and photophobia, potentially leading to obstruction of the lacrimal duct. Cutaneous involvement presents as wart-like lesions or nodules, often in sites of trauma. Other rare sites of involvement include the oropharynx, genital tract, and rectum. Diagnosis involves clinical examination, where characteristic polypoid, friable masses are observed. Histopathology is the gold standard, revealing large, thick-walled sporangia containing numerous endospores surrounded by inflammatory infiltrates. Stains like H&E, PAS, and mucicarmine stain highlight the sporangia. While culture is not typically feasible, as the organism does not grow in conventional culture media, the preferred treatment method is surgical excision, as complete excision of the lesions is necessary to prevent recurrence, which is common if remnants are left behind. Dapsone is used as an adjunct to reduce recurrence by inhibiting sporangial maturation and division, while other antifungals and antibiotics are generally ineffective. Prevention involves avoiding contact with contaminated water bodies and educating at-risk populations on personal protective measures. Complications include recurrence after surgical excision, secondary bacterial infections, and potential spread to other mucosal sites. Rhinsporidiosis, although rare, is a significant health concern in endemic regions due to its chronic nature and recurrence. Prompt diagnosis and appropriate management are crucial.